Hi class, this is Dr. Shahada, and in this video I'll be going over Chapter 11 on government health insurance programs, which means that we'll be going over Medicaid, CHIP, and Medicare. So the first slide just provides a very brief overview of what the chapter is all about. So it provides a basic overview of the major public health insurance programs in the U.S., and it focuses on Medicaid, CHIP, and Medicare. Now, before we really delve into the governmental insurance programs, I just want to make sure that you understand both of these terms. First, the term of entitlement, which is everyone who is eligible for and enrolled in the program is legally entitled to receive benefits from the program. And the second term on the slide is block grants, which is the defined sum of money, often from the federal government to the states, that's allocated for a particular program over a certain period of time. So beneficiaries may be refused service for lack of funds or other reasons, so there's no legal entitlement to the benefits. Now the next slide, we begin covering Medicaid. Now let's start from, so during the Depression and World War II, the U.S. had no funds to really start a universal health care program, which has been an issue that's been discussed for many years. Now, as a result, a private sector system was developed that did not provide health care services to all citizens. However, the government's role of providing health care coverage evolved as a regulatory body to ensure that the elderly and the poor were able to receive health care. So this is what led to the passage of the Social Security Act of 1935 and the establishment of Medicaid and Medicare programs in 1965, which mandated government's increased role in providing health care coverage. Also, the State Children's Health Insurance Program, now known as CHIP, which is Children's Health Insurance Program, was established in 1997 and reauthorized by the Affordable Care Act through 2019 with extended funding through 2015. So in addition to this reauthorization of CHIP, the Affordable Care Act actually increased government interaction with the healthcare system by developing several of the government initiatives that focus on increasing the ability of individuals to make informed decisions about their health care. So in essence, the government increased accessibility to health care as well as provided financing for health care to certain targeted populations. So that's what leads us to Medicaid. Now, I do want to mention that Medicaid and Medicare are entitlement programs. So if you remember the terms that were noted on the last slide, something to remember that Medicaid and Medicare are entitlement programs, while CHIP is a block grant program. So Medicaid is the country's federal state public health insurance program for the indigent. It is also jointly designed and operated by the federal and state governments. So the Centers for Medicare and Medicaid Services is the federal agency in charge of administering the Medicaid program. Each state, the District of Columbia, and certain U.S. territories, as defined in the statute, they have the option to participate in the Medicaid program, and they all have chosen to do so. Now, each state has its own Medicaid agency that's responsible for implementing the program in the state. States file a Medicaid state plan with the federal government, outlining the state's own eligibility rules, benefits, and other program requirements. So this plan is effectively a contract that is between the states and the federal government and between states and program beneficiaries. So in the next slide, we have the eligibility. So Medicaid generally covers low income. It includes pregnant women, children, adults and families with dependent children, individuals with disabilities, and elderly. So there are 5 eligibility requirements. That includes categorical, income level, resources, residency, and immigration status. Okay, so in the next slide, we are looking at the benefits. So the federal and state governments jointly set rules concerning who's covered and which services are provided by Medicaid. The federal government also outlines which populations must be covered. So those are the mandatory populations, and which ones may be covered, which are optional populations. And then they also have benefits that must be covered, as well as those that are optional. So you have the mandatory benefits as well as the optional benefits. In general, states must cover mandatory populations and benefits, and they may choose to cover any combination of optional populations or benefits. So this includes the choice not to offer any optional coverage at all. Also, states may seek a waiver from federal rules, allowing states to experiment with coverage and benefit design while still drawing down federal funds to operate their program. Almost 1/2 of all Medicaid beneficiaries are children, while adults account for about 27% of enrollees. And the disabled and elderly make up the remaining 1/4. So approximately 10 million people are called dual enrollees, or dual eligible elderly. So what this means is that they qualify for both Medicaid and Medicare. Although most dual enrollees are eligible for full Medicaid benefits, a small portion of them receive only premium and or cost-sharing assistance to help them pay for Medicare, not full Medicaid benefits. And there is also a video that covers Medicaid in this week's module. Now I'm going to jump to the Children's Health Insurance Program, also known as CHIP. All right, so in 1997, the Congress created the State Children's Health Insurance Program, which was as a $40 billion 10-year block grant program. It was included as one of the titles of the Social Security Act, and it expired in 2007. Then there were two versions of like a reauthorization act that were brought forth. One was actually vetoed by George Bush, and then in 2009, President Obama actually signed it into law as one of his first acts in office and extended the program until 2019, but only included funding through the fiscal year of 2015. So in April 2015, Obama signed legislation that provided 2 more years of funding. So they are getting funding through 2017. Now, CHIP is designed to provide health insurance to low-income children whose family income is above the eligibility level for Medicaid in their state. And the funding and eligibility expansions of CHIPRA, which is the Children's Health Insurance Program Reauthorization Act, that's what the acronym stands for, are estimated to cover 6.5 million additional children in either Medicaid or CHIP. Now, CHIP has been successful at insuring low-income children and enrolling more than 8 million children. Were actually enrolled by 2013. All right, in the next slide. CHIP is actually an optional program for states, but all 50 have chosen to participate. The states have 3 options regarding how their CHIP program is structured. You have the first option, which states may incorporate CHIP into their existing Medicaid program by using CHIP children as an expansion population. The second option is that states may create an entirely separate CHIP program. And then you have the third option, where states may create a hybrid program with lower income children as part of Medicaid and higher income children in a separate CHIP program. And all 3 options are actually used by the states. All right, now in the next slide, we very briefly touch on financing regarding CHIP. So the federal state have matching programs, which means it's like an enhanced match. The CHIP match will always be higher than the state's Medicaid match. And states receive the payments for the CHIP program in 2-year allotments. All right, so now I'm going to jump to the slide where Medicare is introduced, and I'll briefly cover this governmental insurance program. All right, so the Medicare program, which is also referred to as Title 18 of the Social Security Act, finances medical care for 3 groups of people. You have people that are 65 years and older, individuals that are disabled who are entitled to Social Security benefits, and people who have end-stage renal disease. Now, people in these 3 categories can enroll regardless of income status. So, shortly after the creation of this program, back in 1967, there were about 19.5 million beneficiaries that year. Now, in 2012, we had about 50.7 million. And just to kind of give you an idea of the breakdown between the 3 groups that are eligible and who are actually receiving or utilizing these Medicare services, in 2012, so about 50.7 million beneficiaries, 83% of them were actually 65 years and older, and 17% were under the age of 65. With the aging of the population, the number of beneficiaries will continue to rise. Now, Medicare is a federal program operated under the administrative oversight of the Centers for Medicare and Medicaid Services, which is a branch of the DHHS. And because it's a federal program, eligibility criteria and benefits are consistent on a national level here in the U.S. Now, in 1997, the Balanced Budget Act of 1997 actually established an independent federal agency. And this agency was the Medicare Payment Advisory Commission, also known as MedPAC. And so MedPAC's function is to advise the U.S. Congress on various issues affecting the Medicare program. So MedPAC's statutory mandate includes analysis of payments to private healthcare providers participating in Medicare, access to care, as well as quality of care. All right, so now I'm going to jump to slide 27, and I'm going to briefly go over the 4 different parts. Well, first we have Part A, and this is the hospital insurance portion, and everyone is entitled to Part A benefits regardless of the amount of income and assets they may have. Now, Part A covers inpatient services for acute care hospitals, psychiatric hospitals, inpatient rehabilitation facilities, skilled nursing facility services, home health visits, and hospice care. Now, it's financed through a trust fund that's funded through a mandatory payroll tax, and deductibles and cost sharing are paid by the beneficiary. Then you have Part B, which is the supplementary medical insurance. Now, this portion of Medicare is a voluntary program financed partly by the general tax revenues and partly by required premium contributions. Now, it is estimated that beneficiaries bear approximately 25% of the cost of premiums. Generally, taxes subsidize the remaining 75%. All right, now to the next slide. Now, Part C is known as the Medicare Advantage. And in reality, it's really not a new benefit program because it does not add specifically defined new services. It merely provides defined new some additional choices of health plans with the objectives of channeling a greater number of beneficiaries into managed care. Now, premiums for Medicare Advantage are in addition to those paid to Medicare for Part B coverage. So as a trade-off, the beneficiary gets additional benefits that are not available in the original Medicare plan. And Part C enrollees also have lower out-of-pocket costs. So in essence, it's a cost-effective option, particularly for lower-income Medicare beneficiaries. And the fourth part of Medicare is Part D, which is the prescription drug coverage. And Part D was implemented in January of 2006, and it's available to anyone who has coverage under Part A or Part B. So the prescription drug program requires payment of a monthly premium to Medicare, which is in addition to the premium for Part B. Certain low-income beneficiaries are automatically enrolled without having to pay a premium. I do want to point out that Medicare carries relatively high deductibles, co-payments, and premiums. So a lot of times, like eyeglasses, dental care, and many long-term care services aren't covered. And there really isn't a limit on out-of-pocket expenses, except that about half of the Medicare Advantage plans have cost-sharing limits. I also want to bring to your attention three main factors that raise concern regarding Medicare's future before I wrap up this video lecture. One is that the cost of delivering health care continues to grow at a rate faster than the rate of inflation in the general economy, which is something that I'm sure you're all aware of. Second, the aging population will consume a greater quantity of healthcare services because our aging population is growing. And last, we have a workforce that is shrinking, and wage increases to support payroll tax revenues are smaller than the rise in medical inflation. And that pretty much wraps it up on what I wanted to cover for this video lecture. I know in this presentation there's a lot of slides that I didn't go over. I just wanted to give you the general gist of the primary three governmental insurance programs that are covered in this chapter. Make sure to read the chapter and review all the slides. And if you have any questions, don't hesitate to let me know. All right, everybody, take care. Bye.